Okay, so we are treating a contusion. We have a acute contusion here where it's very visible. So we're not supposed to be doing any on-site work. So this is in the quadriceps, so we're not doing any on-site work. All we can do on-site is compression. So the way that you could do compression is by using some type of bandage or even a towel and compressing the area like this. And you would just leave it like that. And you don't touch it. Another way that you could do it that would kind of be 2-in-1 is place the towel, place your ice pack. Again, you have to be careful of the size of your ice pack. If your ice pack is too heavy, you may injure the client further or hurt them. So again, this one is very big. So I would go with something smaller, and you could always just place the ice pack and use that compression as well. So there you have your rest. She's resting. We have our ice. We have the compression, and then elevation. You can see that the pillow here is elevated. You could place even more pillows here to have her leg go up like this. Okay, so the positioning is fine as long as we don't we don't cause any stress to the contusion itself. And I would do MLD to the areas proximal to this. So I should not be working on her distal leg. I should not be working on her knee. The only thing I can do here is light muscle squeezing and a light stroking. So it should be very light strokes, but that shave technique for the MLD should not be done here because it'll increase the congestion to this area. So all I would do here is pump my inguinal nodes, pump my terminus, pump the inguinal nodes, and then all MLD should be happening in the direction of the inguinal nodes. You do not pump the popliteal nodes. So that's the MLD. I would teach my client deep diaphragmatic breathing. I could do massage on the other leg, on the back, on the glutes, any of that. And then I can do passive relaxed range of motion. If this was a mild contusion, I could do passive relaxed range of motion of the proximal and distal joints. So for this quadriceps contusion, I would do passive relaxed range of motion of the knee and of the hip. So that would just look like flexion and extension. And then for the hip, again, flexion, extension, abduction, adduction, external rotation, internal rotation. We're going to say that she has a spasm as well in her rec fem muscle. So we, again, are not trying to remove this spasm. We should not even be doing any GTO techniques or ONI techniques. None of that stuff should be happening because we're not trying to remove this spasm. So now let's take the same scenario. Now it's been a couple of days, so we're in early subacute. It's no longer acute condition. Positioning, no changes. We're going to keep the positioning the same. Hydrotherapy, no changes. We're going to keep the ice pack. MLD, same thing. We can do muscle squeezing distally. We can do the light stroking. Other than that, our MLD should all be headed towards the inguinal nodes. But at this point, the one difference is that we can reduce the spasm because it's no longer protective. So we can reduce the spasm. If it was the rectus femoris muscle, I could do GTO on the quadriceps tendon and hold here for 30 seconds to reduce this spasm. I could also do my ONI technique here at the quadriceps tendon or at the AIIS, which is the proximal attachment of the rectus femoris. And then muscle approximation again, find your origin, your insertion, origin, and push them closer together so it would look like this. Hold for 30 seconds. That will help reduce the spasm. We can do our general Swedish massage and our trigger point therapy only proximal. So if our bruise is here, we can still do our general Swedish massage here on the upper thigh, and we can reduce any trigger points here on the upper thigh as well. You guys already have the videos for those techniques. If this is a mild contusion, we can start to work on the bruise itself. But if it was moderate or severe, no on-site work because there may be a hematoma there. When we do our passive relaxed range of motion, if it's a mild contusion, we can again do it up to our mid-range. So for example, the knee extends fully like this, but we should try to keep it in mid-range, which is about 30 degrees of flexion. In late subacute, positioning does not change. The hydrotherapy has now changed. Instead of just using ice, you can use warm hydro as well. Unless there's inflammation still present, then you would not use warm hydro. You're not going to spend as much time doing MLD. And what's good now is that you can do your general Swedish massage all on the distal limb, on the compensating structures, and on the proximal limb. You can also do on-site. So I could do my whole effleurage, petrissage, anything I want on here. Again, being careful of not putting too much pressure. Say you do a trigger point technique on the area, I'm not going to place heat here. I'm also not going to stretch it out fully. I can do a gentle stretch. Same thing with frictions. At this stage, frictions are going to start, the adhesions and scar tissue are going to start forming around this area. So I can now do my frictioning technique where I do my reinforced fingers. I let my client know that it's going to be painful, and I start to reduce the adhesions all around this bruise. And again, I can do ice. There's no issues there, but the stretch should be very gentle. The passive relaxed range of motion, we can now start going into full range of motion. So we could even try to flex this knee fully to flexion and extension. There's no issues there. And then joint mobs of the proximal and distal. We haven't done too many joint mobs for the lower body, but we could do a distraction here at the knee. We could do a distraction at the hip, attraction at the hip, distraction at the knee. We could do our anterior glide, posterior glide, oscillations, any of that stuff on the proximal and distal joints. And the last stage is the chronic stage, where you pretty much have as much freedom as you want. The positioning just depends on their comfort. You can place heat on this area to soften the adhesions and reduce hypertonicity, increase circulation. You can do your general Swedish massage on the entire limb, just like you could in late subacute. You can do frictions, and you can do a full stretch this time after the frictions. And then joint mobs, same thing. And passive relaxed range of motion, again, you can go all the way to the full range with no issues. And that's it.